So have Democrats found the issue that will return them to power in the House in 2012? We're joined now by Democratic Congresswoman Gwen Moore of Milwaukee. Congresswoman, good to have you back on the program.
Oh, great being here.
Let's talk about what happened last week in Western New York State. Is this the issue? Is this the silver bullet for Democrats, Medicare?
Well, I can tell you, I think many Americans are very concerned about reining in spending, and I think Republicans overplayed their hand, so to speak, and they thought that that they could start with Medicare, and I think they totally misread the 2010 election results to think that they could really substantially change a program that is very, very popular and very important toward keeping seniors out of poverty. And I think that that the 26th District of New York was really the canary in the coal mine for future elections.
Paul Ryan's been under a lot of fire. You're a colleague. The two of you get along. You've been on the show together debating the issues. Is he being unfairly vilified for proposing a solution, controversial though it may be?
You know, Paul Ryan is absolutely correct that 66% of our budget is consumed by Medicare, Medicaid, Social Security, defense spending, and that these expenses will crowd out other things. But I think where he errs is not really pointing out that the high cost of health care in our country is the problem. And you can't just solve the problem by providing a voucher or premium support and then continue to allow health care costs to grow 2-3 times the consumer price index or 2-3 times our gross domestic product. And that's where his plan is flawed. Because clearly in a memo that was sent to him by the Congressional Budget Office, and I think I shared it with your producer, they have told Paul Ryan that seniors will find themselves paying $6,000-7,000 more in 2022 under his plan, because his premium support only supports those costs up to the consumer price index and not up to the cost of health care. We see healthcare costs rising in this country by 6.6% each year. And a lot of it is because we have huge profits in healthcare, and some of the things that were in the Affordable Health Care Act, so-called Obamacare, were designed to rein in burgeoning healthcare costs, not just within these programs, but in general.
Let me jump in and ask this, though, and say, where's the Democratic plan to take on Medicare? This could be insolvent in 13 years. Where is the Democratic plan?
Well, that is the Democratic plan, the Affordable Health Care Plan.
So you think that will provide enough relief to keep it fiscally solvent?
It's a start. I'll give you an example. The best example I could think of that the Republicans propose to repeal is the requirement that we negotiate drug costs for Medicare Part D. The cost of Medicare Part D over 10 years is calculated to be about $500 billion. And the legislation stipulates specifically that we can't negotiate with drug companies, which the top drug companies make about $77 billion a year in profit. If we were to negotiate drug prices, we could get an average of about $16 billion a year in savings. I mean, why not negotiate across the whole class of Medicare beneficiaries?
I wanted to ask you about Medicare as a theme in 2012, because Nancy Pelosi was asked about this, and she said, what are the three big issues coming up? And Medicare, Medicare, Medicare. But whatever happened to jobs? Isn't that still on the table for Democrats? I mean, you worry that we now become solely focused on the debate over debt and Medicare and not focused on jobs?
Well, you know, actually they're intertwined, because I think that we're focusing so much on reducing the debt and deficit, we don't realize that if we tackle the deficit so much, we will hurt our ability to climb back from this recession and to have our economy recover. Many economists have said that the aggressive pace at which we're cutting, slashing programs will in fact hurt our ability to recover. And so jobs are very, very much at the center of the Democrats' platform for recovery. And health care and reining in those costs is very much a part of our economic recovery.
I wanted to ask you about a topic that is actually more of a state topic, and that is voter ID. We'll soon be required to show a photo ID in the state of Wisconsin to vote. You've been outspoken against that. How soon do you anticipate this will be challenged in court?
Well, I can tell you, I've already contacted the Justice Department. I hope that they will review it. I hope they will look at it very clearly. The proposal that's on the table is much more strident than we've seen in other parts of the country. And when you look at the population of Wisconsin that don't have photo IDs, clearly there's a racial dimension to it. 55% of African-American men have no photo ID. About the same amount of African-American women have no photo ID. Hispanic men and women have no photo ID. And none of the supposed violations, the so-called fraud, would having a photo ID have solved at all. And so I think that this requirement is very problematic, and it seeks to disenfranchise Democrats, many of whom are minorities, young people, and the elderly.
Bottom line, you don't think this discussion is over yet?
Oh, no, not if I can help it. It's not.
All right. Milwaukee Congresswoman Gwen Moore, we appreciate your time. Thanks very much for being with us today.